Hey guys, this is Sahiti Yada, your senior who is helping you out to make the topic simpler for you for your neetpg journey. So usually the kind of videos that I post are only the audio ones, but today I have decided to make a video like revealing the face so that if I tell the schedule just in the voice mode or in the audio mode, it might not help you that much. It might not have that effect on you. So I just want to see the confidence level when I am explaining that schedule for you, so that you will get that faith to believe in me and to like follow what I am saying. So it's not like I have just prepared the schedule. It's like I have imagined myself in your preparation. If I were in your place, what would I have done? So that was my main motto while preparing the schedule. So this is how I'll go about it when I have ample amount of days in my hand for neetpg preparation. So there are more than 100 days we have to crack this neetpg. So there are 130 days for us. So I'll tell you how to plan a day, how to go about division of a month, how many subjects you can cater in a week, and when to give a GT and how to review the GT, and what are the topics that you need to start your day with. So all these things will be explained in this video. So this is the first time I'm using this video mode. So I don't know if I'm looking at you or at the screen or somewhere in the air. I don't know. Just let's get started now. So firstly, I thought of posting this video now because say from tomorrow I'll be busy in this joining process on all the residency process, so I'll not have time to post this video any further. So I just came from outside and making this video for you. So let's get started now. Firstly, we have this schedule starting from 25th of October, guys. So from 25th, our schedule starts. So let me tell you one thing clearly, that you need to complete whatever the subject that you are doing now. See, let's suppose someone is doing CVS from medicine, or someone is reading ENT. So complete that before 25th only, so that all of us together will start this schedule from 25th of October. So I don't know how many people will follow this schedule. So we have a group, right? So let's follow this together. At least some 100 to 200 people, if you follow this schedule, it will be like sufficient enough to get that motivation, daily motivation on how many people are completing, how many people are able to do what subjects at what time and all. So firstly, the schedule is starting from 25th, right? So on 25th and 26th, it's ortho. You have to do ortho. And similarly, like 27, 28, 29 and 30, 4 days for anat. And then comes this micro from 31st to 3rd of November. So here we entered into November month. So everything I have written in yellow is the subject and how many days you have to cater to that subject. And every this circle zone is for GT, guys. So this green circle zone is for GT. So I have planned GTs on alternate Sundays. Sometimes I have skipped the GTs because there will be few times, guys, where you need to focus on studying rather than giving a GT. So it's not like you have to give the GT with your schedule pending, with your syllabus pending. It's always like you need to assess what you have read in that week, what you're going to do for the next week. So that is all GT is about. It's not about scores. It's not about comparing yourself with some other person. Okay. So see here, we have micro till 3rd and ENT 4th and 5th. So you give GT on 6th, and again there is a GT on 20th of November. And in between, I have divided one entire week, which is for medicine and patho combined. Like read medicine integratedly during your first revision, so that you'll have an idea what all to read, how to understand, and how to apply those concepts in your questions. So see, guys, I have divided it like in a week. On 13th, you do endocrine from both patho and medicine. So divide your day into half, like you read medicine, you read patho side by, and you do questions, you do clinical questions, so that you'll understand the topic. And then on the 14th, you do acid-base disorders, whole and soul from medicine. And in that day only, do the miscellaneous topics from medicine. Like if you have any short topics left over from medicine, other than these major systems like CVS, CNS, apart from that, if any miscellaneous topics are there from medicine, you can do in this acid-base disorder day. And 15th is for renal system. You have to do glomerulo nephritis, nephrotic syndrome, everything from patho as well as medicine. And then respiratory system from path and medicine, and cardio, same, and CNS also. For CNS I have given 2 days guys, because many of us will think that CNS is difficult. So in these 2 days please try to understand CNS from anatomy to its physiology to the pathology to the medicine part. So core anatomy to core clinical you have to go through, so that you'll have that confidence in that CNS system that you can solve any possible question that they ask you from CNS. So I have given 2 days for CNS, which is combined patho and medicine. So this line is totally, this week is totally about pathology plus medicine, right? And now then comes the GT day, that is on 20th. Every Sunday, I mean alternate Sundays will be GT days. And then 2 more days for pathology. This is to cover the general pathology guys. So the topics like neoplasia, amyloidosis, etc. should be covered in these 2 days. And I'll give you subject wise division also. Just let me help you understand how to go about this schedule. Like when I gave you this PDF, you need to understand it, what I have written. So that's why I'm explaining. I'll just go faster. So see, surgery is for 4 days, and then pharmac is for 4 days. This completes November month, and here comes December, where the first 5 days are for obstetrics and gynecology, 3 days for obs and 2 days for gynae. Then comes pediatrics, 2 days. Pediatrics you need to complete in 2 days because you have already done with pathology and medicine, right? So by now you must have an idea about a system properly. In peds you just need to know a few milestones here and there, and diarrhea, ORS solution, everything. Those topics you need to learn. So that would just take 2 days. 2 days are more than enough for pediatrics. And then comes biochemistry for 4 days. And in between Sunday, you need to give a GT on 11th of December. And then comes SARP. SARP meaning skin, anesthesia, radiology, and psychiatry. So there's a book called SARP, guys, which is having these 4 subjects. So that's why usually they tend to tell it as SARP. So skin is for 2 days, anesthesia is short subject like 1 day, and radio is for 2 days. Radio I have given 2 days, not because it is my favorite. It's because you need to integrate it with the anatomy. Okay, recently they're asking you the questions like normal CT imaging, and they're asking they're pointing out at one structure and asking you the like labeling of that structure. So those kind of questions you get from radio. So you need to integrate it with anatomy and pathology. So that's why 2 days for radio, and then psychiatry is for 2 days, and physio is for 3 days, and forensic medicine is for 2 days. And here comes the last GT of your first cycle. So for this forensic is the 19th subject that you're doing. So here is the last GT of your first cycle. Remember that. So on 25th, you'll give a GT again. So whenever this Sundays, guys, so what you need to do is you give GT only for 3 hours, right? So rest of the day will be like, there is no schedule for rest of the day. So what you need to do is, if there is any lagging, or if there is any topic that you didn't complete in that entire week, you need to cater that Sunday for that topics. Okay. So here many of you have asked me not just to make a schedule, you also asked me to plan a day for you, right? So this is how my day used to be, more or less, not this properly. So believe me guys, I never made such a beautiful schedule for myself. I just used to scribble it on a paper and just follow that. But now I have used all these colors, calendars, everything to like give this beautiful PDF to you, so that it kind of gives you a motivation to follow it. So firstly, 24 hours a day, right? So many of us will wish for 30 hours a day during this preparation, because we don't get enough time to complete a subject. So but no, we only have 24 hours, right? So in that, 12 hours is for main subject, 2 hours is for high yielding topic for the day, and 8 hours of good sleep. If you ask me one thing that is most important, then that is this part, which is 8 hours of good sleep. So if you have that 8 hours of good sleep, then only you can effectively use your 14 hours of preparation the coming day, the next day. Okay. And 2 hours of break in between. So let us say a typical day starts from 7 a.m. So from 7 to 8 a.m. start your day with custom module. So you just woke up, you prepare this custom module while brushing, guys. Like you just need to open the Marrow app or the Prep Ladder or whatever you are using. There is custom module, this thing. I mean custom module you can prepare in all the learning apps, I think, by now. So I used to have a Marrow app. So what you need to do is in custom module you need to make 50 questions per day. Okay, if you are just starting now, then start with 25 questions per day. So previously also I have emphasized in many videos regarding this custom module. So if you people have started that, since then only, then you can continue with 50 questions. If few people are starting just now after this video, then start with 25 questions a day. So what you need to do is you need to apply the filters like PYQ, images, and clinical. So these are the filters that you need to apply. PYQs from both NEET and inicet. Since you are preparing for NEET exam, NEET PYQs more than inicet, but you need to cover inicet PYQs also. Remember that point. So 50 questions custom module you have done from 7 to 8. So what you need to do is 40 minutes for 50 questions, so that it increases your speed, guys. In custom modules, always it is like a mixed bag questions, right? So you don't have that lengthier questions. You will have that one line questions also sometimes. So it should take you only 30 seconds to solve one liners. Okay, so 40 minutes for 50 questions is the nice strategy to follow. So please follow that only. 40 minutes 50 questions, and then you complete your like brushing, bathing, whatever, having breakfast, everything while doing the custom module. And then sit properly on your study table. Like now your focus day starts. So what you need to do between 8 to 9 a.m. is review the custom module. So you have to review the wrong questions that you made. So let us say our schedule is starting with ortho, right? So what I have done is 7 to 8 a.m. I have picked up 50 random questions from ortho. So I have solved it, and then I got to know that I made a mistake in this eponyms of osteochondritis. Like I have made a video recently on that, so that thing struck my mind. So yeah, there is a mistake that you made in that topic. So what you need to do is you just need to open your book, fastly go through the topic, or read the explanation that is given below in your app. Okay, read the bold lines and where you have made mistake with what other osteochondritis that you have confused this with. You need to have that self-assessment. So you do that for 1 hour. All the wrong questions you do, and those topics you just scribble down on the paper, so that you'll have an idea what all you need to cover in the coming 2 days of ortho, like today and tomorrow. So what you need to do, you'll get to know. And from 9 to 11, watch a rapid revision video. So most of the people won't tell you the importance of these rapid revision videos, guys. So always we have this wrong idea that rapid revision is something that we need to do in the last months of preparation. But I would say no for that, because rapid revision video kind of gives you an idea about how to go with the subject, like what are the important topics in that subject. So I would ask you to watch rapid revision video only for 2 hours a day, from 9 to 10 and 10 to 11. Let us suppose now you are doing ortho, so let us say Abbas Ali sir's video. There is one video, like I think 2 to 3 rapid revision videos on marrow, edition 5. So I don't know about edition 6, guys. So please do watch the videos, rapid revision videos, because what happens is when you open the rapid revision video, let us say the first video is having all this general orthopedics and pediatric orthopedics. Let us suppose. So in that 1 hour, so we'll be teaching you like what are the important points. And rapid revision videos, the most important pro in these videos is mostly lecturers will get you that concise tables, guys. So whatever we will have, even in my mind, like we'll read some 20 pages, and we always have that thought in back of our mind that we have to prepare some concise notes, we have to make 20th notes out of it. But what happens is when you watch these rapid revision videos, most of the topics will be concised by lecturers themselves. So like from them only you are getting the concise table. So that is like best thing, no? So you'll get to know all the concise tables, all the concise images, everything at one place in the rapid revision. So for 1 hour, watch the video, simultaneously go through your book, flip through the pages. Don't just watch the videos. You have to watch the video, so that it's just like someone is there with you who is teaching you side by, and you are also reading. If you guys don't have any plan C of Marrow or any Prep Ladder or an academy, something, you don't have any app using any subscription, so don't worry. If you are okay with reading the books, then go through the books fastly. Only rapid revision videos are to give you that motivation and idea of what to read in a day. So for 2 hours, watch the rapid revision, and in that 2 hours, there will be some 6 to 7 topics covered by the lecturers. Then what you need to do is read the notes from those topics from 12 to 2 p.m. Along with that, do the question bank. So solve at least 4 to 5 modules from like 12 to 2 p.m. solve 3 modules, and then in the rest of the day solve 2 modules, like 5 modules a day and 50 questions in the morning. Total together it will complete 100 questions a day for you. So solving 100 questions per a day is so mandatory. I cannot even emphasize on like how much it is important. Okay, 100 questions a day is like for sure you need to do that. And See, 12 to 2 p.m. you'll read your notes and solve 2 to 3 modules from QBank from that topics, and 3 to 6 p.m. again you'll do notes and question bank. 6 to 7 take a break. So this break can be a complete break or just half an hour go for a walk, and remaining half an hour what you need to do is you can just watch the mnemonic videos of your favorite lecturer, whoever it is, like on YouTube or somewhere. You must have saved the videos, or you must have saved some mnemonic screenshots and all, right? You need to go through them, because I don't say only with mnemonics you can crack the exam, but it's like if you read the mnemonic, it's like fun way of learning things, and you'll have those things in your brain for longer time. Okay, so that will help you in the exam to some extent. Okay, so watch the mnemonic videos. Now that many of you are finding few of my videos helpful, right? So you can you can cater this time for my videos or Nikita ma'am's videos or Zainab ma'am videos, or like whoever the teacher it is. Then comes 7 to 10, 3 hours you do notes and QBank of that subject of the day itself. Then in the night from 10 to 11, so what you need to do is high yield topics, guys. So let us say you are doing anatomy today, but you have forgotten some splints topic from ortho. So what you need to do is you have to go through the PDF if you have any. Zainab ma'am has taken a class on splints, all the images in one PDF. So just go through the PDF for 10 to 20 minutes so that topic is completed. So that is the high yielding topic of that day. So you need to decide what are the high yielding topics, and I'll provide you a list also from each subject so that you'll have an idea what to read in this 1 hour of the day. Or sometimes you can revise the pearls that you have saved from that subject, like anatomy, or any charts on your wall, something like that. Any concise things you need to learn in that 1 hour. So here this completes the how to plan a day properly. So 2 hours of break is one here, like for lunch 2 to 3, and then here you have one more break which is 6 to 7, that is for mnemonic videos. So here is how the first cycle will go. Like by 24th of December you need to complete forensic, and 25th you need to give a GT. Then how to analyze a GT, guys. So you give the GT, and then what you need to do is analyze the GT over a week. So let us say I have got some 120 questions right in today's Sunday's GT. So what I need to do is first I need to go through the wrong questions in Sunday, like for 2 hours. Just go through the questions that I made wrong and what is the answer, why it is the answer. Just not to read entire explanation in Sunday itself. Just know where I am wrong, why I am wrong. That's all. Just go through the questions fastly, like 80 questions are wrong, right? I'm 200, I got 120, so 80 are wrong, and some will be unattempted in that. So those you have to go through. Then over the week what you need to do is first day of the week give it for first year subjects like anatomy, physio and biochemistry. So here comes when to review the GT. So I have told you to do the high yield topics in last 1 hour of the day, right? So 10 to 11. If you guys are okay with it, or if you guys are okay with 7 hours of sleep, see, even if I tell that 8 hours of sleep is important, many of you will only sleep for 7 hours, 6 hours because of that fear of completing this portion, right? So if you have to extend your time, like let's say you are sleeping at 11:30, so what you need to do is from 10 to 10:30 or 10:45 do high yield topics, and from 10:45 to 11:30 review the subjects anatomy, biochem and physio for first day, and second day of the week review SPM and OBGY, these two major subjects, and the third day review short subjects like ENT, ophthal, dermat, SARP plus ENT, ophthal, and then on the fourth day review medicine, on the fifth day review surgery, ortho, pediatrics, on the seventh day review the rest of the subjects like forensic medicine and pharmac, micro. The leftover ones you can review on the last day. So that way you will have in touch with all the subjects, right? So you will get to know what are the mistakes that you are making. So let us say when you are reviewing the micro, you made mistakes in one stains topic, like bacterial stains topic. So what you need to do is you have to decide if you want to read the topic or not. If you want to read, then open that PDF or that part of notes and just go through the stains ones. Not all the stains, guys. Just don't go through all the common stains also. Read the stains that you have been forgetting since many days. So you have to revise the things, right? So you have to look at those things which you are making mistakes in. So that is how you need to do the GT review. And then comes the second cycle of revision. So see, I have written second cycle of revision. So now that you understood, you'll able to like read this schedule, right? From 26 to 29, you need to complete ortho anat, then micro everything. GT is there in between. These are the GT days, and see, by 9th of February. So this is Feb. From like till 9th, there is this second cycle. So by 9th, you need to complete biochemistry. Okay. So what you need to understand here is one point, that your preparation should be like a funnel. So in the first revision, you need to read what all you can read. It should be from cover to cover. Whereas in the second revision, you need to know what things you don't know, and then you have to revise those things and mistakes from GT and the repeated topics and all. And the third revision should be so narrower that you only read the topics that you frequently forget and that are frequently tested in the examinations. So that should be your strategy of revision cycles. You should not expand it. You should actually narrow it down. You should where is the screen? Yeah. You should actually narrow it down so that you read so much in the first revision, then little in second, and so little in the third revision. So little but too effective for the exam. So that is the concept. And then here you have from 10th to 28th, you need to do one subject a day. So 19 subjects. So you have 19 days for this. One subject a day. I don't know. I think let us not talk about these last 20 days of that tension period now. Let us complete these 2 cycles perfectly so that you yourself will get a confidence to complete anesthesia in 3 hours, psychiatry in 4 hours itself, and Dharma you can just complete in 1 day, and ortho in 1 day. You'll get that confidence for sure, guys. Please trust me in this. So you need to complete these 2 cycles perfectly so that you'll definitely know or get yourself a strategy on how to complete one subject in 1 day in these last 20 days. So tentative date is given as March 5th, right? So the D day. Before that day, you have these 4 days. So I have written the volatile PDFs, charts, images, everything that you need to know. And Zainab ma'am's BTR sessions are there. So if you follow Zainab ma'am, you must have known that about that sessions by now. So keep those sessions for the last weeks. I think let us confine our discussion to the first 2 cycles of revision only, because I have planned them so neatly that you have every subject in the schedule. You will complete that reading twice. Now coming to the important topics from every subject. So see, here is the PDF. Here are the topics that are given by Zainab ma'am. This is also on our group. This PDF is also on our group, but I have concised it for you in a single sheet so that it will be easier for you. Not so many pages in one PDF, so just 1 page. See, orthopedics, all the important topics are given here, like eponyms, cast planes, sports injuries, speech orthopedics, especially hip orthopedics, bone tumors, arthritis, nerve injuries, amputations. So all these topics are important from ortho. So the things that are highlighted in red here are the topics that I have already completed making mnemonics in my channel. So on arthritis, I made a video. On amputations also, I made a video. So all my videos will be short videos, guys, less than 20 minutes or less than 10 minutes sometimes. So all those videos that I made are highlighted in the red. So cranial nerve columns and cranial nerves also I have done. Pharyngeal arches is the recent embryology video that I have taken. And diaphragm embryology, that openings, T8, T10, T12 level. So everything I have explained in a video. So those things I have highlighted, whatever are in my channel. See, mosquitoes with PSM. I have given you one entire vector sheet, right? Like all the vectors that you need to know and all the diseases that they cause are given in that sheet. So like that, whatever I have done are highlighted in the red. Now, so here in PSM, I have made a video on bioterrorism. And ESI video I'll make, guys. This will be a short 5-minute video that you need to know in ESI Corporation in SPM. I'll make that video also. And yeah, rest all topics are written, and I have divided the days for major subjects. Like anatomy, we have given 27th to 30th. So on 27th you need to do upper limb, lower limb, thorax. On 28th it's embryology, abdomen and pelvis. Then 29th neuroanatomy, osteology. And on 30th histology and leftovers from anatomy. See, guys, I have divided the days, like what all you need to do. Like microbiology also on 31st, general mycology, that is fungi. But one more strategy that you can follow is, you are watching rapid revision video, right? So in the morning, if you have watched for 2 hours, what are the topics that are completed in that 2 hours by sir or ma'am? those you have to finish in the rest of the day. So if you target like that also, then most of the things will be covered. Like see, whenever we start a subject, we always think that the part that we don't know is important, but it's not like that. It's always PYQs that are important. It's always the frequently asked questions that are important. So in those topics you need to be perfect. It's not like you have to do it from like total from cover to cover. So whatever the topics that are given here should be your criteria to be like it should be like a checklist. You have to tick these over. Like whenever you complete a subject, like let's say you have done with you are done with microbiology, then you must be able to tick these out. Like general micro is done, images is done, parasitology is done, mycology, like that. In the 4 days you need to complete this checklist, as well as the PYQs you need to solve from the question bank, right? And from that PYQs you'll get to know about the PYTs. So that topics you need to learn from all the subjects. So here is the list. If you have any doubts from this list, you can ask me on our Telegram channel. I'll respond to you guys on the group. So yeah, this is what is given. One second. See, this is the problem with this. Yeah, see here in the corner I have highlighted SARP subjects: skin, anesthesia, radiology, psychiatry for you. And most of the topics that I have taken are from physiology, guys. So measurement of body fluids with ICF, ECF, there is one video, and Darrow and diagrams is the second video from this topic. So these 2 videos, if you watch, you'll never make a mistake from these topics. I'll assure you that, because I have got you questions also in these videos to understand the topic properly, to apply the concepts also. And this types of transport mechanisms is the video coming up, which will be some 20 to 25-minute video. I have brought all the types like active, passive, transcytosis, pinocytosis, exocytosis, everything in one single sheet, so that it will be easier for you to revise in the last days. And membrane potentials also I'll make one video. This video is done. And the JVP also I'll make one. Hormone receptors, actions, and spinal cord tracts. These are all on my list, so that you can expect these videos from my channel. So you can skip these topics. Maybe you can skip this topic, so that I'll be explaining you everything that you need to know from these topics, so that you'll not have that pressure of completing everything on your own. Now here is the division for physiology 20, 21, 22. Yeah, so these are the dates and the subject divisions. So from the forensic also, the stains of blood and semen is already done. It's already on the channel. So please guys, do follow the channel for like the videos. All those videos will be like mnemonics only, and you can complete that topic then and there itself, like in that video itself. It's not like some conceptual hi-fi sentences and all. It's just the mnemonic videos, few easy tricks to learn the topics. So it will be easier for you to complete those topics. So this completes the schedule, 2 cycles, and the important like topics. And here comes the page which shows the YouTube channel and Telegram channel. So if you don't know how to join the Telegram channel, so look at here. When you open the Telegram app, there is a search here. There is a search column here. So there you need to type @nutshell Nairobi. You don't forget to type this @ because that will direct you to the group. So type @nutshell Nairobi, and you'll get directed to this group called as Nairobi's Nutshell channel. So this is our group where I post the questions, and later I'll post the video regarding that question, so that you'll have that entire enclosure of that subject or that topic. So this is the regarding Telegram channel, and here comes the YouTube channel. These are the playlists, guys, all the subject playlists that you have. So you can just enter into one playlist and watch all the videos and complete that subject there. So these are the 2 channels that I thought of introducing to the new people. And this is how one can crack neetpg in 130 days. So this is the most important slide, which is consistency is more important than perfection, guys. It's not always necessary to complete every point from your notes. It is always necessary to complete all the PYQs of that topic, all the high yield topics, and the PDF that I have provided, which is from Zainab ma'am's channel. And yeah, I hope this video will help you. And if there are any doubts regarding the schedule, you can always ask me. You can always ask me on the group. So yeah, thank you. Bye.